Hi, are you a professional driver who needs your DOT medical card and you need it soon? Do you have questions about some aspect of it, health problems, medications, or anything else? If so, this video is for you. Hi, my name is Dr. Richard Matthews. I'm a board-certified chiropractic neurologist and a certified medical examiner with the FMCSA. I've been doing DOT physicals since 2014. And my goal is to get you compliant with the rules, but keep you on the road. I'll do my best for that. Today, I'm going to show you how to schedule, how to get this done. How do you get your card? This is my website, dotexamforyou.com. And it's a simple website. There are only two options on it, really. One is to click here to schedule your exam. The other is to click here to book an information session. First, we're going to look at how to schedule your exam. The box says we try to keep you driving, which I do. So click here to schedule, and I'm going to click on it. This is my regular chiropractic neurology website that pops up. This is where the scheduler is, and you'll see DOT Physical in Florida. Now I'm going to pick a day that I know I don't have anybody scheduled, tomorrow, and then you can pick a time that would work for you. So you select a time and then you click next. Then there are some simple data fields here about who are you. You can also put a message in, and I'll see that message when it pops up on my schedule. And then you simply click on book it. That's all there is to it. Now, on some days, you may find that we can actually do a same-day DOT physical. But this is a Housecall DOT physical. I come to you, which is kind of neat in itself. It's a bit unique and hopefully convenient for you. But it also means practically we have to make sure that I'm someplace where I can actually get to you by the time that you schedule. So I can schedule the same day, but please call me. The phone number is on the DOT website. It's also on this one. It's the 888 number. If you give me a call, we can see where I am. I may be in Okeechobee or Palm City or Jensen Beach or Stewart or someplace around here. So we just have to make sure that I can physically be there if it's the same day. If it's the next day, that should not be a problem. Then, if you have questions, let's say you don't know if your medication is legit, or if you've had an injury, if you had a surgery, if you've had a heart problem and you're not sure, should I do the DOT physical now? Should I wait? Is there a risk of me not passing? I actually offer an information session. It's just $50. We call on the phone or talk on Zoom if there's something you need to actually show me, a scar or whatever it might be. And this is how you do it. Back from the DOT exam website, you just scroll down to, do you have questions? Want to know if your medication is an issue? Click here to book an information question and answer session. And guess what? That opens a different box on the scheduler that says DOT Physical Q&A, get answers. And it's the same procedure. Pick a day that you want to do, and then pick a time that you want to schedule it, and then you fill in your information. Nothing to it. The purpose of that is really just so you have a chance to ask questions and see if there's something you need to get done maybe before your physical. The most common example of that is if you're an insulin-dependent diabetic. I just did a video about that last week. But you know, with that as an example, if you use insulin, there's an additional form that you have to have your medical doctor fill out, whoever it is that writes you the prescription for the insulin. And you have to actually bring that to your DOT physical in most cases. And you have to have blood sugar logs. And it's all outlined in the other video. So just look at my channel and pick the other video. Or if you have further questions, of course, schedule a question and answer session. We'll get all your questions answered. Now, just a word about the practical aspects of a Housecall DOT physical. I show up, I've got the ability to print portably. I can print the forms right there on site and give you your medical card and a copy of the long form so that your employer or yourself has that. And I think you have to bring one of those to the Department of Motor Vehicles as well in most cases. But what we need is you'll have to have a bathroom so you can pee in a cup so I can put the dipstick in it. It's not a drug test, but we do test for 4 different things, including blood sugar, or not blood sugar, but urine sugar. And it's another way to make sure that you're not an uncontrolled diabetic, because we do not want you passing out at the wheel while you're driving 40 tons down the road. You don't want to either. And if your blood sugar drops enough, that can actually happen. If you're an uncontrolled diabetic, your blood sugar may go really high sometimes and really low other times. And that's a bad thing. We do not want that happening to you. If you want additional health information on how to help improve from health conditions like high blood pressure or blood sugar, I am a natural practitioner with 31 years of experience doing that. And I can certainly give you some advice on how to be healthy and how to help yourself improve your health so that it's easier to pass DOT physicals, as well as probably easier to feel well. So this is all you need to know as far as scheduling. Click on the box, click on the date, come on date, click on the date, and then put in your information. Click on a time and then put in your information. All there is to it. So if you liked the video, please click on like. If you want to see more of this kind of stuff, please click on subscribe. If you have an additional DOT related issue that you'd like me to look at, I welcome the suggestions. I plan on making a lot more of these videos. So just leave a suggestion in the comment section below the video. With that, that's all I have. So keep it between the ditches, drive safe, and I will talk to you next time.